So I think the biggest thing is that there's a lot of hope that it potentially can cure or reverse vision loss. And so a lot of the treatments that we have available right now have a limitation depending on how much damage is done to the retina already. And so patients who are in the situation where our more traditional treatments are not offering further improvement really seek out other potential treatments. And that's when they find out about these companies through web searches. And the companies have very professional looking websites that can be very convincing. And so I think it's difficult for patients sometimes to discern what's a legitimate study versus what's happening at these clinics. And what adds another layer of complexity is that a lot of these companies potentially can list a study on clinicaltrials.gov, which is a study repository. It's not an endorsement by the government at all. It's just a listing of all studies that are available. And so for some of the patients that we've experienced with complications from these stem cell clinics actually thought they were enrolling in the study because that clinic happened to have a study that was posted on clinicaltrials.gov. So I think that there is a fair amount of educational material that's available through the American Academy of Ophthalmology for patients, as well as the National Eye Institute, and the information is available. We certainly need to do our part of educating the patients about their disease process. I think that the patients who are most susceptible to looking for these cell therapy clinics are those patients that just don't have a treatment available for their disease process. And I think that that's a tough message to hear for patients, very understandably, if you feel like there's no option for you. And it's understandable why they're looking for other options. It's just, unfortunately, I think that there is a degree of risk in looking for the treatment options at these clinics. So in terms of the cost of healthcare, it's a very prevalent thing. We see that it just keeps continuing to rise, and so there certainly is a demand for biosimilars that are able to produce the same results as the medications that we're using right now. And so we have a quote-unquote biosimilar right now with bevacizumab that is very effective and is able to get good results for our patients. And so that's been very beneficial for the treatment of patients, and it would be great to have more of these in our armamentarium, especially as we look forward towards more longer lasting or extended release type of medications. To be able to get biosimilars for those would be outstanding.